Good afternoon, Congressman Peters and staff. Thank you very much for taking time to meet with me today. I'm here to talk about an issue which I think we should all be much more concerned about in San Diego County, and which, as you'll see, affects me personally, and that is tick-borne disease, and specifically Lyme disease. Lyme disease is an infection caused by a bacterium. It's a spirochete, and syphilis is also a spirochete bacterium. But in the case of Lyme disease, it's called Borrelia burgdorferi. And the spirochete is transmitted to humans when they're bitten by a particular species of tick, Ixodes scapularis, or the black-legged tick that's carried by deer. So basically anywhere in the country where deer roam, you will find black-legged ticks, and likely you'll find evidence for Lyme disease. If you're bitten by a tick, in some cases you will evidence immediate symptoms, and often they're fever, flu-like symptoms, and occasionally a bullseye rash. In about 50% of the cases, you'll see a characteristic bullseye rash. But in the other 50%, there is no such characteristic rash. So you may be unaware that you've been bitten by a tick and you've been infected by this spirochete bacterium. If you are treated promptly following infection, within perhaps a week or 10 days, with a sustained treatment of the antibiotic doxycycline, the infection is usually, but not always, cleared. If, however, you're not treated promptly, then there's a reasonable likelihood that the disease will progress into a chronic state where it's largely recalcitrant and it's not clear you can ever completely clear the disease from your system. This particular spirochete has the ability to go into a cyst form, which is basically, at that point, it's even if you have systemic antibiotics delivered, the spirochete tends to be inert to the action of those. It's a very refractory form. And if you have chronic Lyme, there is increasing evidence that it may play a role in a large number of medical conditions. There have been recently reports of people who have died suddenly from cardiac failure where they found spirochete bacteria in the heart tissue. And there are many reports, some locally here, of people that have had sustained severe symptoms from chronic Lyme disease. Interestingly, the annual incidence of Lyme in the US is 6 times that of AIDS. So AIDS, in terms of incidence, is 50,000 people a year. Lyme disease is, as reported by the CDC, is some 300,000 new patients each year. On the other hand, the funding that goes into tick-borne disease is 0.002 that of the funding that goes into AIDS. So the AIDS funding is about $32 billion a year. But in 2009, we don't have more recent data, the funding was only $0.08 billion. So we have a national epidemic that's 6 times more impactful than AIDS in terms of people affected, but the funding is dramatically less. Here in San Diego, even though the original recognition of the disease was in Old Lyme, Connecticut, about in 1976, I believe was the year, that essentially all states in the US, apart where they've been studied, there is incidence of Lyme disease. The challenge here in San Diego is that the number of cases reported to the CDC is relatively small, so it's maybe around 10 to 20 each year. But I believe that number represents dramatic underreporting of the prevalence of the condition for a few reasons. The first is that the local medical community is largely unaware of this disease. If you be unfortunate enough to suffer from it, particularly chronic Lyme, and you go to an infectious disease specialist in San Diego, they know very little about the treatment of this condition. The second reason is that the species of tick that carries the disease in California is different from on the East Coast, and the spirochete itself that gives rise to Lyme disease in California is also different from that on the East Coast, and hence the diagnosis by certain techniques may be confounded. But the fact is, where studies have been done, and they haven't been done extensively in San Diego, they have been done further north in California, in the Bay Area, where a group from Stanford studied a variety of public parks, and in every one of them they found ticks that were carrying Lyme disease. So it is here and it's all around us. So what can you do to help the community that's being exposed to this disease? Well, Congressman Peters, the first thing that you can do is to join the bipartisan Lyme caucus in Congress. That would be an easy thing to do, and we very much appreciate doing that. The second thing that you can do is to support Bill S-1503, which is entitled Lyme and Tick-Borne Disease Prevention, Education and Research Act of 2015. It was approved by Congress, but then it was held up in the Senate and is still languishing. And the third thing, coming back to the points that I've made about the funding levels for Lyme disease, which are woeful given the prevalence of the condition, is I'd like you to agitate for increased federal funding, and federal funding in 4 key areas. The first is to increase public awareness. We're all potentially exposed to this debilitating condition. We should be aware of the risks that we take and how we avoid getting bitten by these ticks. The second thing that we need increased funding for is to improve the diagnostics for the condition. There is really no way today of diagnosing someone who has chronic Lyme condition, and because of that, the medical community is divided as to whether it even exists as a condition. If we had better diagnostics, that would remove that complication. The third thing, of course, is better treatment, and finally, given the importance of this condition nationally, it is time, we think, to pick up again on the concept of developing a vaccine for this condition. So we'd very much appreciate it, Congressman Peters and staff, if you give care and consideration to supporting greater activities on the tick-borne disease front. Thank you.
That was about 8 minutes.
That was about 8 minutes.
That was about 8 minutes.
But they were good 8 minutes.
Well, they actually really were a good 8 minutes. So